Automated classification of gastric neoplasms in endoscopic images using a convolutional neural network. Introduction. Gastric cancer remains a global health burden and is the fourth most common cause of cancer-related death worldwide. Most early gastric cancers, EGCs, lack clinical signs or symptoms and are difficult to detect and treat in a timely manner without screening strategies. Patients with premalignant lesions, such as a gastric dysplasia, also have a considerable risk of developing gastric cancer. Korea has the highest incidence of gastric cancer and adopted the National Cancer Screening Program in 1999. With the widespread implementation of endoscopic screening programs, the proportion of patients with EGC at the time of diagnosis has increased. Although endoscopic screening programs have reduced gastric cancer mortality rates by 47%, the detection of gastric neoplasms remains a challenge because it is dependent on the endoscopist's experience, expertise, and skill. Moreover, repeated endoscopic examinations have been associated with decreased mortality rates from gastric cancer, and longer inspection times have been associated with higher proportions of neoplasm detection in Korean studies, indicating that one-time screenings are not a perfect method. Endoscopy is used for both screening and diagnosing a variety of gastrointestinal diseases, including gastric neoplasms. A high-quality endoscopic examination is necessary to detect malignant and premalignant lesions, especially in areas where gastric cancer is prevalent. Detection of abnormal lesions is usually based on abnormal morphology or color changes in the mucosa, and diagnostic accuracy is known to improve through training and the use of optical techniques for chromoendoscopy. The application of endoscopic imaging technologies, such as narrowband imaging, confocal imaging, or magnifying techniques, so-called image-enhanced endoscopy, is also known to enhance diagnostic accuracy. However, examination solely with white light endoscopy remains the most routine form of screening, and standardization of the procedure and improvements in the interpretation process to resolve the inter-observer and intra-observer variability are needed in image-enhanced endoscopy. Therefore, meticulous inspection of the stomach, discrimination of the lesions, and a targeted biopsy are the key factors in diagnosing pathologic lesions. Recently, the use of convolutional neural networks, CNNs, to recognize and differentiate medical images has been increasingly adopted in clinical practice. This technique has already shown promising diagnostic performance using endoscopic images, such as detecting gastric cancer, recognizing Helicobacter pylori infection, classifying colorectal polyps into neoplastic or non-neoplastic features, and distinguishing Barrett's esophagus and neoplasia. However, there have been no studies on the application of CNNs in the classification of gastric neoplasms based on white light images. This study aimed to develop a deep learning model to automatically classify gastric neoplasms based on white light images and to evaluate the model performance. Background: visual inspection, lesion detection, and differentiation between malignant and benign features are key aspects of an endoscopist's role. The use of machine learning for the recognition and differentiation of images has been increasingly adopted in clinical practice. This study aimed to establish convolutional neural network (CNN) models to automatically classify gastric neoplasms based on endoscopic images. Methods: endoscopic white light images of pathologically confirmed gastric lesions were collected and classified into 5 categories: advanced gastric cancer, early gastric cancer, high-grade dysplasia, low-grade dysplasia, and non-neoplasm. 3 pre-trained CNN models were fine-tuned using a training dataset. The classifying performance of the models was evaluated using a test dataset and a prospective validation dataset. Results: a total of 5,017 images were collected from 1,269 patients, among which 812 images from 212 patients were used as the test dataset. An additional 200 images from 200 patients were collected and used for prospective validation. For the 5-category classification, the weighted average accuracy of the Inception ResNet V2 model reached 84.6%. The mean area under the curve, AUC, of the model for differentiating gastric cancer and neoplasm was 0.877 and 0.927 respectively. In prospective validation, the Inception ResNet V2 model showed lower performance compared with the endoscopist, with the best performance, 5-category accuracy 76.4% versus 87.6%, cancer 76.0% versus 97.5%, neoplasm 73.5% versus 96.5%, p less than 0.001. However, there was no statistical difference between the Inception ResNet V2 model and the endoscopist, with the worst performance in the differentiation of gastric cancer. Accuracy 76.0% versus 82.0%, and neoplasm. AUC 0.776 versus 0.865. Conclusion. The evaluated deep learning models have the potential for clinical application in classifying gastric cancer or neoplasm on endoscopic white light images.